Bay Area health officials are keeping a close eye on the Omicron variant. Dr. Karin Shavelson with Marin Health joins us now. Thanks for joining us.
Thank you for having me.
So the World Health Organization named this new COVID-19 strain a variant of concern. We know that all viruses mutate. So why is this particular strain causing so much concern?
Well, first of all, I think it's important for your viewers not to be overly alarmed at this point in time. There's a lot that we don't know, and what we do know is we think the vaccines will offer significant protection. This variant is a bit more concerning because some of its mutations suggest that it may have higher transmissibility than even the Delta variant, meaning it could spread more quickly. And we're still trying to assess how dangerous it is. What does it mean for your health? How sick can it make you? And we don't know any of these things for sure just yet. So I think in the vacuum of knowledge at the moment, and time will give us a lot more knowledge, but right now I can understand why people are worried about this particular variant, but I want to reassure you, please don't be overly concerned just yet.
And it's early, as you mentioned. Any idea just how much more transmissible this is than the Delta?
Right now, the early reports make it look significantly more transmissible, but we don't know if this is a super spreader event or if this is true innate transmissibility of the virus. The news is evolving by the moment, as you know. I tried to update myself before this interview, and I was impressed to see that the virus was detected in the Netherlands a week ago. So there's a lot that we don't know yet. It's really about sleuthing and looking at all the clues and putting together as much data as quickly as we can. I think by the day, even by the hour, we're learning more and more about this variant. I think we all have to be prepared with this COVID, this coronavirus, that this won't be the only mutation, unfortunately. We're going to be facing this for some time to come. And until we see the entire world with better vaccination rates, we're providing an opportunity for this virus to mutate. And so we'll continue to face these scenarios again and again.
Any idea yet whether this new strain causes more severe illness than the other strains?
Yeah, we don't know quite yet. The data out of South Africa suggests that it doesn't make you as sick, but we have to recognize that the patients there were young people, and we know that young people don't get quite as sick as those of us who are older or more frail. So we need a bit more time to see what the clinical disease looks like with this variant. We just don't know quite yet. As a reminder, when you contract coronavirus or COVID, you don't get super sick right away. It takes 1, 2, even 3 weeks before you end up needing to be hospitalized. So there's this lag time, and I think that's what the world is seeing right now, this lag time before we truly see how sick it could make somebody.
And I know this is a question that a lot of people have. Do we know if the current vaccines will protect us against this new variant?
We feel quite confident, and Dr. Fauci, who is the source for much truth, also feels quite confident that our current vaccines offer tremendous protection. It might not be quite the protection we're seeing against Delta, but we feel it offers such good protection that we really, really encourage you to follow the CDC guidelines to get vaccinated. Please also get your booster. Many of us are ready at the 6-month mark to receive our boosters, and it's going to be imperative. And as a reminder to your audience, right now in the United States, Delta is still our biggest enemy. There are areas of the country that are battling Delta in impressive surges. Really, another wave is hitting in places like Colorado. We're quite lucky in the Bay Area because of our high vaccination rates and because we're all really careful. We haven't seen a big Delta surge here, but it's definitely a reason to get vaccinated, especially in this holiday season. Delta is what everybody should be the most concerned about at the moment. But whatever your reason, be it Delta or Omicron, please go get your vaccine and get your booster.
And you mentioned this could be around for a long time. How many more of these variants could there be in the future?
It's really hard to predict at this time. I think that the most important thing is for developed countries to provide vaccines to underdeveloped countries that don't have the financial or operational mechanism to obtain and distribute vaccines. So we've already seen some of the Western countries step up and provide vaccines throughout the world. We need to continue to do this. And even here in our westernized, very advanced country, we need to continue to encourage everybody to get vaccinated. We know with Omicron, the suggestion is that previous infection, that immunity is not going to be very robust to protect you against Omicron. We know it's not great at preventing Delta infection. So relying on previous infection isn't going to get you so far in the future. So get your vaccine, please.
Do we have any information yet, Dr. Shavelson, about how Omicron is affecting different groups of people, for example, the elderly or the immunocompromised?
We don't know quite yet. We did see some transmission in 2 fully vaccinated people. They don't have clinical disease at this time. We would suppose that it would be very similar to the variants that we've seen so far, meaning the older, the frail, those with less than robust immune systems. Unfortunately, as we age, our immune systems, just like a car, as it gets older, it has a few clunks and problems. As we get older, our immune systems are not so robust. So definitely, if you're higher risk, older immune system dysfunction, you need to absolutely get your booster. But really at this point, everybody who is eligible should be signing up to get a booster, particularly going into the December holiday season. It's really important to get vaccinated. If you haven't, and please get your booster.
Yeah, for those planning to gather with friends and family for the holidays, should they be rethinking their plans?
Absolutely not. I think at this point, if you're fully vaccinated, particularly if you have your booster, I encourage you to spend time with your family. I know some of us have family members who aren't vaccinated for whatever reason, and as much as we've tried, we've not been able to persuade them. That would be the guest that I would be a little bit more concerned about. One option for guests who are not fully vaccinated would be to encourage them to use one of the rapid antigen tests. You can pick these kits up quite easily at pharmacies or order them online. They're best if they're 2 tests about a day apart, if you want to increase the strength of the test. Obviously masking if possible, and then ventilation. So if our beautiful Bay Area weather persists through the holidays and your gatherings, if you can be outside, that would be great. If you can't be outside, open up all those doors and windows as best as you're able without everybody getting too chilly.
Let that airflow in. Great advice, Dr. Karin Shavelson with Marin Health. Thank you so much.
Thank you.